Hello to everyone. My name is Gouveia. I'm a fourth year orthopedic resident from Portugal. I'm here today to present my work about lateral approach versus double approach with plate in patients with bicondylar tibial plateau fractures. As we know, bicondylar tibial plateau fractures often result from a higher energy mechanism. Their surgical management is a challenge. These fractures have a high unstable posteromedial fragment in 33% of the cases. The surgical approach remains controversial, so with this work we want to compare the anatomical and functional results after external approach alone versus double approach in the patients with bicondylar tibial plateau fractures associated to the posteromedial fragment. Was our study design. So we retrospectively studied during 5 years 22 patients. In the group 1, we had 13 patients with a sternal plate approach to the bicondylar fractures. And then in the group 2, we have 9 patients with a double approach. We compared radiologically with X-ray and CT scan the results of the immediate postoperative and the last follow-up of all patients. The quality of reductions in the immediate postoperative period and the loss of reductions of the posteromedial fragment at the last follow-up and the worst of the tibial varus of more than 5 degrees and the non-union of posteromedial fragment was analyzed. We also compared the incidence of postoperative skin or septic complications in the two groups, and we measured the tools of the functional results with the Lee-Scholl score and the International Knee Documentation Committee score. This was our results. So the mean age of the patients was 43 years, the mean time to surgery was 3.5 days, and the mean follow-up was 2 years. As complications, we don't have any case of skin complications in the both groups, and we have 2 cases of the early sepsis noted in the group 1. In the group 1, there was a failure to reduce the posteromedial fragment in 8 cases. We have a loss or reduction of the posteromedial fragment seen in 5 cases, and the worst of the tibial varus more than 5 degrees was seen in 7 cases. Non-union of posteromedial fragment was seen in 4 cases. In group 2, we have better functional results when compared to the first group. We note 1 case of failure to do reduction of the posteromedial fragment, 1 case of the loss of reduction of the posteromedial fragment, and 1 case of the worsening of the tibial varus more than 5 degrees. And we don't have any case of non-union in posteromedial fragment. We found that the immediate reduction quality after the surgery have the direct effect in the tibial varus aggravation of more than 5 degrees. So with this study, we can conclude that the association of the posteromedial buttress plates with the sternal plate in the treatment of the bicondylar tibial plateau fractures with a posteromedial fragment allow a better immediate reduction and a decrease of the risk of the aggravation of the tibial varus without increasing the risk of skin and septic complications. Thank you all for the attention, and I hope you have a good Congress. Thank you.